Healthcare is our next topic here, and the healthcare plans from Obamacare losses may raise rates just before the election. In other words, there may be a November surprise with higher rates that people have to pay before the election. And here to talk about that, which is why we had to move on, the former Deputy Secretary at HHS, Tevi Troy, Health and Human Services. It's good to see you again, Tevi. This would be something, right, if higher premiums were a story right before the election. Obviously, I guess it's obvious, wouldn't be good news for Hillary Clinton, right?
Yeah, that's clear. It wouldn't be good news for the Democrats, whoever it may be, likely Hillary Clinton. But higher premiums have been a consistent theme for the last few years. It's just that under the latest news, it appears that those premiums would really take a bite starting November 1st, and that's when the consumers would feel them, and that's why it's an extra big problem.
Yeah, these reports that we're going on are citing companies. You know, the United Healthcare has already done it, pulling out of the exchanges. They're anticipating $650 million in losses this year. Other companies have talked in similar terms, Aetna and others. So the companies are up against it, right? And then they have to pass on the costs?
Yeah, and it's clear. I mean, you see someone like Blue Cross Blue Shield, who are heavily involved in the exchanges. They're seeing profits going down. So you're seeing this across a lot of companies, and then you had the co-ops, which were there to try and find a subsidized way to keep these exchanges alive, and 11 of the 23 co-ops have failed. So the problem is there's a real misconnection with the risk pool in the exchanges. So you have more sick people than anticipated and fewer healthy people, and that's going to cost more.
So how to get away from well, it is a political question, but to get away from just the politics and who it helps, who it hurts. I know Hillary Clinton has talked about kind of extending Obamacare and just trying to get the remaining people covered. Bernie Sanders wants to break it down. Of course, Trump wants to repeal it, and the same for the other Republicans, were they to be the nominee. But this problem that we're talking about now, how would you fix it? Could you mix and match and kind of come up with a plan that makes things better, or is the system just not working in your view?
Yeah, it's a really good question, and I am skeptical of any sort of take-off-the-shelf government approach. I think we tried a big picture approach with the Obamacare, and I think it has a lot of problems. I think I would advocate for a more modest approach. I think there's a lot of technology out there that's leading to improvements. I think the employers, who still cover about 170 million people, are doing some interesting things and innovative things. And I would give the system a little more room for employers to experiment and for some of these innovations to take hold, and not double down on the ACA as Hillary Clinton said she would do.
Okay, so that's not an Obamacare tweak, just so I understand it right. That is a new system, is what you're saying. You would have to be repeal and replace, which is what the Republicans are advocating for. Is that right?
Basically, but what I'm saying is you really need to focus on what's working in the healthcare system and not count on government to control prices and to keep the costs down, because we've seen we had a pretty heavily government approach the last couple of years, and that is not working.
Okay, fair enough. Good stuff from Tevi Troy, as always. Good to see you, Tevi. Thank you very much for coming on.